Thank you. We have a treat for everyone. My good friend and longtime CLL patient, uh, Terry Evans. Terry is entering his third decade of managing a CLL. Patient and caregiver support groups are an important resource, and you know we don't want any CLL patient to feel that they have to handle their disease alone. We now have an interview or discussion between Patricia Kaufman, my wife, and the co-founder, communications director at the CLL Society, and Terry Evans, a 20-year CLL survivor, and who directs our CLL support group, to discuss what you need to know about CLL-specific groups. Afterwards, we'll have another 10-minute break, but hurry back because we're going to be covering Richter's transformation, clinical trials, vaccines, going into a deeper dive into CAR T therapy and COVID-19, and 5 quick PowerPoint presentations by 5 rock stars in the CLL pantheon. So take it away, Terry and Patty, please.
Hello, everyone. I'm Patricia Kaufman, co-founder and communications director of the CLL Society, as well as Dr. Kaufman's wife and caregiver. I'm here today with Mr. Terry Evans, Director of CLL Society Support Groups. Terry is an inspirational 20-year survivor of CLL. He has had a major hand in the creation of the infrastructure that supports our support groups. Terry sets the tone, sets the ground rules, and models best practices for the volunteer facilitators he trains to lead our groups. Today we bring you Terry's story, and we'll give you insight into how our support groups work so that you can judge for yourself whether joining a support group might be appropriate for you. So let's hear Terry's story. Terry, I understand that when you were first diagnosed in June of 2000, you knew nothing about CLL. You knew no one with CLL, and I assume that you were not in the care of a CLL expert. You've described those first 8 years in your CLL journey as a very lonely time. And then there was a crisis. What changed?
Well, I went from being a patient of watch and wait or watch and worry to a patient that needed treatment within a 2-3 month period. And I realized then that I knew very little really about the disease, and I needed to educate myself. So at that point in time, I kind of took more charge of understanding the disease, and joining a support group happened to be something that kind of fell into my lap.
So you found our very small support group, which was started by Brian Kaufman and a handful of other people. And later the CLL Society was formed. And now with you at the helm, the CLL Society has grown to support over 35 support groups across the country. And we have another 12 or so in formation. So what benefits come from joining a support group? And why would you recommend that people join one today?
I think when you first get diagnosed, you really are in shock, and most people don't know anybody else with CLL. And what a support group does is it gives you a chance to meet other people that have CLL, maybe long-time CLL. It gives you hope. It gives you information that you might not normally get from either maybe your medical team or maybe online forums. And it gives you a way to personally connect with other CLL patients, which I think is huge in helping you through your journey.
Well, our CLL Society support groups are led by patient volunteers, and all of them are trained by you as opposed to being led by healthcare providers. So tell us a bit about what kind of help patients can bring to other patients that healthcare providers can't offer.
I think that we are unique in the fact that we are a patient-led support group, and we feel that that gives us some independence in terms of the things we talk about, and we're not monitored or filtered in our comments about maybe a particular treatment or a particular medical team. And I think sharing the journeys of other people with other patients and caregivers is really important, because not everyone responds the same to treatments, but you can get a variety of ideas from other people in the room about how they were affected by that treatment. How well did it work? What side effects did they have? And you can really get a broader picture of what your journey might look like in the future.
Well, for the sake of brevity, I'd like to run through some quick yes or no questions commonly asked about support groups. So I'll play the role of a patient who's interested in joining a support group. Do I have to come to every meeting?
Absolutely not. We have people that come to one meeting every month, and we have people that come every 6 months.
Can I bring my caregiver with me?
Absolutely. This group is for patients and caregivers. It's extremely important, I think, to have a team behind you, and a caregiver provides the patient that team.
So what if I'm in watch and wait and I've never been treated, of course? Can I also come to a meeting?
I think it's probably the most important time for a patient to go to meetings, is to learn more about the disease and what their options are. So absolutely.
Not everyone that I know knows that I have CLL. How do you handle confidentiality in the group?
We have a guideline form that people sign when they come to their first meeting. We feel that everything talked about there should be confidential, and we treat it that way, just as if you were talking to your doctor.
What if I know nothing about CLL?
Most people don't know anything about CLL when they get diagnosed. And the comments are, it sounds like a foreign language to me. And over time, you gain knowledge and understanding of what some of these terms mean. But that's the way you basically get educated, is by coming to meetings and learning more and more about the disease.
Can I listen only in the meetings, or do I have to speak?
No, we don't force you to speak. If you don't feel comfortable talking, that's fine. People do that on a regular basis, but really the most important thing is for you to listen and gather knowledge.
Carrie, how are you holding meetings now during the COVID-19 pandemic?
Well, for the past 6 or 7 months, we've held our meetings virtually, which has actually worked out really well. We don't know when we will go back to the live meeting format, which used to be our model, but I think that the virtual meetings have really worked out well for us.
The calendar of monthly support group meetings can be found on our website at cllsociety.org. How can I start a group if I want to do that?
There are lists of cities where groups may be forming, and you can fill out a survey form. And in that survey form, you may also indicate that you might be interested in leading the group. We provide training for facilitators. It's not really that you have to be a CLL expert to be a facilitator. It's just somebody who is interested in CLL and is willing to send out email invitations and monitor attendance. But you do not have to be a CLL expert to facilitate a group.
Terry, do you have parting comments that you'd like to share with our listening audience?
Well, I can honestly say that I think joining a support group and leading a support group has changed my life. When you go from not knowing anyone with CLL or not knowing anything about CLL to really sharing experiences and helping people on their journey, I don't want people to make the same mistakes that I made, and that's why I readily admit what I think were my mistakes. And I think that's where the groups really play an important part in sharing of each other's journeys. And you can learn so much by interacting with other patients and caregivers. And I think if you're at all interested, you should go to the CLL Society website and either fill out an information form or find a meeting that's taking place in your city.
Thank you so much, Terry. You've changed the lives of so many CLL patients. And thank you for this interview today.
You're welcome. Thank you.
And so there you have it. The CLL Society support groups are a warm and welcoming place that can provide emotional support because they're filled with CLL patients and caregivers who understand what you are going through. They are a place of discussion and learning. They are a place where you can learn to put together a strong healthcare team. They are a place where you can learn to advocate for your best personal care. You wouldn't want to miss this. Join a CLL Society CLL-specific support group today.